So patients who come in for chin or neck liposuction, they tend to be in their 20s and 30s, and they're frustrated by a fullness behind their chin crease here. A lot of them talk about having a double chin or a roundness or a fullness here that bothers them. They want to get a cleaner jawline, they can't take good selfies. You know, nobody wants a double chin. What we offer them here is smart liposuction. That means basically I like to do this operation under local anesthesia. It's very well tolerated. Don't worry, you'll be fine. We've done over 1,000 of them in the office at this point. We mark you in the standing position right here in the spot that I'm standing, as a matter of fact. Then we go into the operating room. I use a needle. I don't even use a scalpel. We poke a hole in the crease behind each earlobe and one into the chin crease here. And we inject tumescent fluid in the space between the skin and the muscle of the neck. That's where the subcutaneous fat is. That's important because if you have deeper fat, I need to do a different operation. But for subcutaneous fat, it's pretty simple. We inject the area with tumescent fluid, which is essentially saline with some lidocaine to make you numb and a little epinephrine so that your blood vessels constrict and you don't bleed very much. Next, I like to use Smart Lipo. So Smart Lipo is a laser that is inserted under the skin through that same little poke hole. It's only 2 millimeters wide, and it goes under the skin, and we pass the laser around and it melts the fat and heats up the tissues in the area. We know from a variety of studies that if we can get the soft tissues to hit 42 or 43 degrees centigrade, that's the temperature at which collagen and elastin will start to get a little tighter. So all the devices that are out there are doing the same thing. It's just a matter of which patent they have. Now, Smart Lipo is using a laser to do it. Other devices might use sonogram energy or radio frequency or something else. Anyway, once we hit temperature, we're done with the laser. We put the laser down, and now all I have to do is suction out that fat, again, which is in the subcutaneous space. I like to use all three of those holes, those three incisions, to triangulate and clean up the whole area from earlobe to earlobe and from the chin crease to the Adam's apple. And it usually goes pretty well. It takes us about 30 minutes. When we're done, we ask you to wear a compression garment around your head. It is not subtle. It looks like you're wearing a bra on your head. Sorry, you're going to have to lay low for a few days, Netflix and chill. But most people, the vast majority of people, by day 5, are back at work and out and about living their lives. Typically, there's very few telltale signs. Maybe a little bit of bruising, but it typically settles down in the lower portions of the neck, so if you're wearing a colored shirt, you can get away with that. You won't have a result for about 3 months or so. Men might take a little longer. Men are more like 4 months. But in about 3 months, you should have a much cleaner jawline, and your double chin really should be gone if we're doing this for the right reasons, if we've chosen the right procedure. Again, there are other procedures for deeper fat or other types of fullness in the area. But if you've just got a little subcutaneous fat in the zone, liposuction is a very good option for the chin. When we're done with the procedure, you can walk out of the office because it's all done under local anesthetic. You don't need an escort. We ask you to take a cab or an Uber or something. I'd rather you not get on the subway, but you can certainly leave here of your own accord. You know, you're on your own, you'll be okay. And here is an example of someone who came in, was a great example of someone who was frustrated by the double chin, and a little liposuction helps to clean it up quite a bit.